James Stevens is known as the father of Clearwater. He and his brother Samuel were two of the first settlers in Clearwater. James McMullen and his brothers arrived in the area in 1840, and they held government positions during the early years of the city. As the city grew over the year, its economy shifted from farming cotton and vegetables to tourism. In 1915, Clearwater was officially incorporated. After that, the city continued to grow into what it is today. Housing in Clearwater is made up of large waterfront mansions all the way down to rundown homes on Fort Harrison. The majority of the houses are owned, however, there are a lot that are rented. There are also housing subsidies that can assist those who are unable to obtain housing on their own. Some of these corporations include Pinellas County Housing Authority, Goodwill, and United Church Homes. Food availability is abundant in Clearwater. During the windshield survey, there are multiple stores such as Publix, Walmart, and convenience stores seen. Many of these stores accept EBT or food stamps for those who meet requirements for assistance. For those who are unable to buy food on their own or who are temporarily going through a hard time, there is a food bank located on Druid Road that provides nutritious food to those who need it. They have a warehouse that distributes food to the people of the community, as well as local food pantries, homeless shelters, and soup kitchens. RCS has both perishable and non-perishable foods available to those who need it. While it is an excellent resource for those who can't afford to purchase groceries, RCS is only available to provide 3 to 4 days worth of food for the entire household per visit. It's a wonderful start. However, since they rely heavily on donations, the organization is simply unable to provide more food to the community. Transportation in Clearwater consists of private vehicles on roadways, taxis, and public buses. PSTA buses provide transportation all throughout Pinellas County. Bus fare is $2.25 per ride. However, there are programs such as DART for those who are unable to physically get on a bus and providing discounted transportation for senior citizens and those who are disabled. Clearwater has a high percentage of elderly population, 21% above the age of 65, who may not be able to ride the bus, and DART fare is $4.50, which may pose a problem for those who are on a fixed income. I think that with the resources for transportation, food, and housing, the structure of the community adequately meets the needs of the people of the community. There are some shortcomings with regards to food pantries and the amount of food available for the people who rely on this for their main sources of food. However, the fact that there is a place to go and get free food is a great resource for those who need it. With regards to transportation, the roads are in good condition and traffic flows well. The public transportation system runs throughout Pinellas County and covers most of the county for a low rate. And PSTA also has programs to help those with lower income be able to afford transportation. "23,459 people of the community are over the age of 65. However, there is an increasing number of people who are coming to Florida to retire, which are referred to as snowbirds. The growth is astronomical, with the state population estimated to reach 26 million by 2030. This growth brings issues to the community, such as accessible land for homeowners at a reasonable price and increasing cars on roadways. One issue that is brought up in an article by O'Donnell is that as a result of increasing amount of people in the state, there will be an increase in vehicles on the road during natural disasters such as hurricane evacuations. Another issue that can arise from a rise in the older population is the need for health care for the increasing population. There's one hospital in Clearwater, which is Morton Plant Hospital. Other communities face similar issues. In an article written by Conroy and Turpin, the United Kingdom faces similar issues, with increasing emergency department patients that are of the older population. Among those coming to the emergency department, there is an increase in the older population who are admitted to an acute care unit. With more admissions comes more negative outcomes, with an increase in situations such as readmissions, decline in mentality, or decrease in quality of life. Taking these things into consideration and applying them to our own community, it becomes clear that community resources are imperative to the quality of life to our older population. If we take a minute to think about the article and the fact that there is going to be an increase in the elderly populations as snowbirds flock the state, it would also make sense that there will be an increased need for assisted living facilities and rehabilitation centers to accommodate the increasing needs of the older population who are being admitted to the hospital regularly and will need increasing help at home. With the need for facilities growing, it would also require more healthcare workers to run the facilities to provide quality care to the people it is servicing.
There are several quality healthcare and social work facilities located within the community. Pinellas County Human Resources is located in western Clearwater and offers services for low-income individuals such as pharmacies, affordable healthcare resources, emergency financial assistance, family housing, financial assistance, dental services, and senior connections. The cost of services at this facility is income-based. It is easily accessible and located near several bus stops. The Kimberly Home is a pregnancy resource center that offers services such as assistance to women and families in unplanned or troubling pregnancies, crisis hotlines, and free pregnancy tests. The services are free and the facility is easily accessible and located near several bus stops. Morton Plant Hospital is the major hospital located in this community. Cost is based on the services rendered and the kind of insurance the person has. This hospital is easily accessible and located near several bus stops. Bayside Urgent Care is located in western Clearwater and offers services such as eye and ear infection treatment, UTIs, minor fractures, sprains, strains, flu treatment, colds, wound care, lacerations, insect bites, non-narcotic medication dispensing, X-ray, lab, EKG, and physicals. Cost is dependent on services rendered and the kind of insurance the person has. The facility is centrally located and near several bus stops for easy accessibility. Baycare Behavioral Health Life Management Center is located in western Clearwater. Services provided include outpatient counseling, group therapy for those struggling with mental health and substance abuse issues, and prescriptions. Cost is dependent on the kind of insurance the person has. The facility is easily accessible and is located near several bus stops. Aging Wisely is located in western Clearwater. Services include home safety assessment, care planning, coordination of community services, Medicaid assistance, insurance assistance, counseling, advocacy, home health coordination and monitoring, and special needs assistance. Cost is dependent on the kind of insurance the person has. The facility is easily accessible and located near several bus stops. Three community objectives from Healthy People 2020 that are relevant to this community are family planning, access to health services, and tobacco use. Family planning services helped prevent nearly 1.9 million unintended pregnancies in 2015. Negative outcomes associated with unintended pregnancy include reduced breastfeeding, increased risks of depression, increased risk of physical violence, and decreased birth weight. Many women can benefit from preconception care. The Pinellas County Health Department has several programs that are available to this community that help with family planning and preconception care. Access to healthcare services is important for promoting health and managing disease. Some barriers to accessing health services include high cost, lack of available services, and lack of insurance coverage. Access to quality healthcare improves one's overall quality of life and impacts physical and mental health in a positive way. There are several quality healthcare facilities located in this community that can accommodate all levels of income and needs. Tobacco use and secondhand smoke can cause heart disease, stroke, cancer, lung disease, and reproductive effects. Each year, 480,000 people die of the effects of tobacco use in America. During the windshield survey, there were several people seen smoking in the community. Education about the adverse effects of tobacco use and secondhand smoke and providing adequate resources to help people quit can be very beneficial to this community. Environmental health involves controlling and preventing injury and disease related to the interactions between the environment and people. Sustaining a healthy environment is directly related to increasing years of healthy living and quality of life. Environmental factors that relate to health include air contaminants, natural disasters, climate change, occupational hazards, water supply, and exposure to hazardous substances. The Air Quality Index is published daily at 11 a.m. and 4 p.m. on the Pinellas County website. The Air Quality Index reports how clean the air is and any health concerns associated with relevant air contaminants. This resource is adequate because it gives people the chance to view the air quality on their own time and learn about the different contaminants in their community. Pinellas County Utilities provides water that meets all state and federal standards for safe water. They routinely monitor for over 80 contaminants in accordance with federal laws and regulations. This service is adequate because our water supply goes through several processes and has very strict regulations before it reaches our homes. This community provides adequate places to dispose of hazardous waste material. Residents of Clearwater can bring up to 6 electronic or hazardous items to the drop-off located in northwestern Clearwater. If residents are unable to make the mobile collection dates, Pinellas County Utilities has a collection site for all residents of the county. The Department of Solid Waste Operations Household Electronics and Chemical Collection Center in St. Petersburg is open 6 days a week and drop-off is free of charge. Air contaminants, water supply, and hazardous waste supply are all issues pertinent to the community related to environmental concerns.
Government and public policy City Council meetings are usually held on the first and third Thursday of each month in the City Hall Council chambers at 6 p.m. According to the local City Council member, these meetings are well attended and provided ample information on current issues in the community. As citizen of Clearwater, you may speak at the council meetings freely on the agenda items or non-agenda items at the beginning of the meeting. Community officials are very accessible to the residents. The offices hold open assembly twice a month, which citizens may submit about their concerns for the community. If a citizen of the community misses a meeting, they may view it online at a later date. Or if a citizen wishes to not attend the meeting but would like to watch the meeting, they can view it at the website address as listed above as a live streaming video. Government and public policy City Council meetings are usually community needs. Through a windshield survey, a community health nurse can determine the needs of his or her community. After their observations, they can provide the residents with education and prevention programs which are appropriate for the people of Clearwater, specifically identified by the details of the windshield survey. The top priority in the Clearwater area is skin cancer awareness. A majority of the City of Clearwater residents observed outdoors in the afternoon heat were without protective clothing or sunscreen to shield them from the damaging UV rays. According to the research, minorities have a lower awareness of skin cancer than Caucasians. Increased exposure to ultraviolet rays increase the rate of skin cancer. With an average annual temperature of 71 degrees, the City of Clearwater residents have the opportunity of more sun exposure than most. With educational programs, the community health nurse can educate the people of Clearwater on the importance of sun protection, thus decreasing the risk of skin cancer. Next would be the prevention of smoking. During the observation of individuals outside in the sun, it was noted that most of these individuals were smoking. Not only is this bad for the individual, but it is harmful to the individuals around this person. The community health nurse can provide these individuals with educations on smoking cessation, as well as educating them on the harms of secondary smoke inhalation. Community needs. Through a windshield survey, a community health. Third would be the education of obesity. Along with skin cancer awareness and smoking cessation, the community health nurse can educate the resident of the dangers in obesity. With the overwhelming rate of fast food restaurants popping up all over the area, it is easy for the community to slip into the ease of picking up a quick meal. These meals are usually unhealthy and can lead to obesity. Fourth would be educating the community of motor vehicle safety. The City of Clearwater Fire Department claims most of the service calls this year are for motor vehicle accidents. While driving around the city, it was observed individuals were multitasking, which included texting while driving. This is a major problem and can be fixed with a simple educational seminar put on by a community health nurse. Third would be the education of obesity. Fifth is educating the elderly on fall prevention. After interviewing the City of Clearwater Fire Department about motor vehicle accidents in the Clearwater area, it was also brought to our attention that approximately 25% of the emergency calls are related to falls. This is a major concern for our community because these falls can result in severe injury or death. The community health nurse can be helpful in this situation by providing education on fall prevention to the elderly and to their loved ones to help prevent falls from happening in the future. Sixth is education of alcohol reduction. Over the past few years in the City of Clearwater, an abundance of pubs and taverns have been popping up everywhere. This is an issue for the residents of Clearwater because the increased consumption of alcohol can lead to many health-related issues such as cirrhosis. By educating the people on such concerns, this may help lower the amount of alcohol consumption in our area. Fifth is educating the elderly on fall prevention. After